I'm Dr. Gary Churchill, a facial plastic surgeon at the Center for Facial Plastic Surgery. One of the most common procedures I perform is rhinoplasty, which is also known as a nose job or plastic surgery of the nose. There are a number of reasons why people choose to have this type of surgery. One is for obstructed breathing due to a deviated septum or other nasal malformations. Also, people come in just to get an improvement in the appearance of their nose, and it is not as painful as people would imagine. In the past, these procedures were performed with general anesthesia. Today we perform these procedures with twilight anesthetic right here in the office. The benefits of twilight anesthetic are that patients wake up much quicker and feel better immediately after the surgery. I do open rhinoplasty, which is making an incision at the base of the nostrils, which as it heals will disappear and leave no visible scarring whatsoever. The advantage of this technique is that I can see the structures in the nose much better and give a much more predictable and superior result. And the other advantage to patients is that I don't have to pack the nose at the end of the procedure, which makes it much more comfortable for them in the post-operative period. Rhinoplasty is reshaping the nasal structures, both the cartilage and the bone, which changes the shape of the nose from the outside. If the septum is deviated, we also change the structure of the septum, either by repositioning cartilage and bone, or sometimes removing a little bit of the cartilage to allow a straight septum so that the airway is clear so the patient can breathe better. After I make sure the septum is straight, I then focus on the structure and shape of the rest of the nose. I start at the nasal tip cartilage. The nasal tip cartilage is often wide or too rounded, and so we typically remove a section of that cartilage to give the person a smaller or more narrow tip to the nose. Once the tip is set where we want it, then we focus on the bridge of the nose. Most people come in with a bump on their nose or some structure they would like to reduce. So we remove a strip of cartilage and bone from the bridge of the nose to make it straight. We want to avoid any scooped out look, as that will not look natural to the patient. One common misperception is that we break the bones in rhinoplasty surgery. This is not true. What we do is we make controlled cuts in the nasal bones to allow us to bring them back to a midline straight position. Once the bridge is straight, the nose looks good from the profile, but now I have to make the nose look good from the front. That usually involves narrowing widened nasal bones, as well as straightening bones that are deviated. Because the incision is closed at the end of the operation, there's very little bleeding and there's no packing necessary. This is in contrast to the way rhinoplasty used to be done, where incisions were made in multiple locations inside the nose and packing was required to control the bleeding. That was very uncomfortable and made rhinoplasty a very painful operation. Once we've repositioned the nasal bones, we apply a splint that stays on for 1 week. This holds the nasal bones while they heal in position. The small incision we made at the beginning of the operation is closed with tiny dissolving sutures. These come out when we take the splint off at 1 week. One of the benefits my patients find in having surgery done here versus a hospital is the atmosphere, which provides a very private environment and highly personalized care. We give them one-on-one attention. They don't go to a recovery room filled with other patients. There's just one nurse to one patient. Also, the risk of infection is much lower in an office setting. One of my biggest concerns, as well as the patients, is that the nose looks natural. In fact, we have a 0% infection rate over the last 22 years. While I perform these surgeries on a routine basis, I realize each patient coming in, it's their one surgery and the one time they're going to have this done. I strive to give them the best result I possibly can to fulfill their desires for the result that they're looking for. If you feel you're interested in rhinoplasty surgery, first you have to decide what you would like to change. Then you schedule a consultation, and when you come in, we put your picture on the computer, and I actually do computer imaging to show you what the possible outcome would be. In computer imaging, we put 2 pictures of you on the screen. One picture would be your before picture, and the second one we change with computer software that shows the possible changes we could make to your nose. Computer imaging is important because it lets me gauge what you're looking for so I can deliver the results you want. The best part of the surgery is when the splint is removed and the patient gets to see their new nose for the first time. There may be a little bit of swelling, and that resolves usually in the first few months. Then we take after pictures. And when we review the before and after pictures with the patient, my patients have told me what a difference it makes in their life and how their self-esteem has been boosted by having this surgery done. Once the appearance of their nose is improved, their self-confidence goes up, their self-esteem is boosted, and it affects all aspects of their life. One of the most gratifying aspects of doing rhinoplasty surgery is that it's a permanent surgery and it stays with the person for the rest of their life. So the improvement they see maybe when they're a teenager will carry through until old age. My greatest satisfaction is making my patients happy.